I welcome you to the third lesson of this video course on this book, Positive Health, Health Beyond Pills. This is a book that talks about holistic health. It entreats you and teaches you how to think holistic health, how to pursue holistic health, and how to live holistic health. Now, in this lesson, we are looking at the difference between disease and illness. And there are two problems that necessitated the inclusion of this lesson, where we want to understand the difference between disease and illness. The first one is that there are people that when they have a physical disease, a disease in their physical body, when they have some, let's say, hypertension or diabetes, and they have some chronic disease, they are thinking that it defines their entire life, and so they cannot live a new normal life. All right. But the reality is that you can have a disease and you are not going to feel physically ill from that disease. And you're not going to feel some pain from that disease. You're not going to feel discomfort from that disease. So you can still live a new normal life even with disease. The second problem is that there are people that have chronic disease, hypertension or diabetes, for instance, and we know hypertension especially does not usually cause symptoms. So these people are on hypertension medications and they stop taking their medication. And the excuse is that they don't feel any symptoms from the hypertension, and so why should they be on medication? Okay, so you need to understand that the fact that you have a disease does not mean that you feel some discomfort from the disease, feel some pain or illness or symptoms from the disease. That is why you need to understand this lesson, because it borders on your well-being. So there's a difference between disease and illness. Now, what is illness? When we talk about illness, we are referring to the symptoms the patient experiences, the pain, the discomfort, that feeling of feverishness, the vomiting, the dizziness, the headache. So what the patient experiences is what we refer to as illness. We say the patient is ill. Now, these symptoms are just manifestations of an underlying problem that we are yet to explain. Okay, and there are explanations for these manifestations. These explanations are what we call diseases. Okay, so for a particular set of symptoms, there is a particular disease that is explaining these symptoms. All right, so illness is what the patient is experiencing. And then when a doctor explains the illness into a disease or a diagnosis, then we say that the patient has a disease. Okay, so the disease is a diagnosis of the physical manifestations that the patient is experiencing. Okay, so we like to say that an illness is what the patient has when he or she is going to the doctor's consulting room, and a disease is what the patient has when he or she is leaving the doctor's consulting room. We also like to say that an illness is what is happening to the person, or an illness is what the person has. And a disease is what an organ has, or an organ in the body is experiencing, or the organ has. Okay? Now, there are three scenarios when it comes to disease and illness. The first scenario is that we believe that once you have a disease, it should lead to an illness. So commonly, diseases lead to physical manifestations that are experienced as illness. All right. However, we can have a second scenario whereby you can have a disease like hypertension and you don't experience any symptoms from this disease. So we say that you are not ill from the disease. So you can have a disease without an illness. You can have asthma, which means you have a tendency to react to things, for your airways to react to things, okay, and get an attack. But once the attack has not come, you are not ill. All right? You are walking about with what we call chronic asthma, but you are not ill. Okay? You can be somebody who has epilepsy. It means that you can have convulsive attacks, but you can have stable periods Once the attack has not come, you are not ill. You can have somebody who has sickle cell disease. That means the person can have a crisis, sickle cell crisis, can have some bone pain, joint pains, or can have some crisis that will make the blood cells to break down. The person's blood level gets to become low. You have to sometimes give blood to that person. But the person can be stable, walking around with a disease, sickle cell disease, but has no crisis, no illness. So we say the person has a disease but does not have an illness. Okay? Then we can have a third scenario where the person has no disease but feels ill, especially psychologically. So somebody can have a lump in the breast, or may think she has a lump in the breast and is thinking that it's cancer. Because the person is thinking it's cancer, the person has some negative thoughts, so some psychological disturbance, in quotes, psychological illness, okay? And this person cannot sleep. It's disturbed psychologically. So we say this person, and you go and do further tests, you realize that the person does not have even any lump at all that looks like a cancer. Okay, so this person has no disease, but is worried psychologically that she has she's going to get breast cancer. Somebody may just have a cough, which is some upper respiratory tract infection, or be thinking that the cough is because of some tuberculosis or some lung cancer, and is not able to sleep. The person is worried and anxious. So psychologically, the person is ill, in quotes, but physically, that cough was probably an upper respiratory tract infection. It was nowhere near being a cancer or tuberculosis. Okay, so in that sense, there's no such disease, but the person is disturbed in the mind. You have somebody who has tumor, okay, on the skin and is thinking it's a cancer, but later you find out that was no cancer at all. So no disease, okay, like a cancer, as the person was thinking, but the person was psychologically disturbed. Sometimes people even have false positive results. So the person will have a lab test that shows that the person has some disease, but you do another lab test, you do further assessment, the person, you realize the person, it was a false positive result. So in that sense, that person got worried, anxious for nothing, and there was no disease. So it's possible not to have a disease, okay, and be worried and be anxious. And it's also possible to have some mild form of a disease and exaggerate it and be worried and be anxious. So we say that you have a disease, a mild form of a disease, and a lot of that is generating a lot of anxiety and fear, or you have no disease at all, yet you have something to worry about and to be anxious about. Okay? Now, two main reasons, again, why knowing this is important. The first one is that once we know that you can have a disease and not have symptoms. So if you have hypertension and you don't have symptoms, you are walking around living your normal life, it means that you can live a new normal life with disease. You don't have to think that once you have diabetes or hypertension, it defines your entire being. So you cannot live a new normal life. And you don't have to feel ill from a disease psychologically by letting this hypertension or diabetes disturb you psychologically, especially because it's not even disturbing you physically by making you uncomfortable, giving you some pain or discomfort. It also means that you don't go off your medications which are preventive medications, because the asthma is not giving you an attack, so you stop the preventive medication you're using. Epilepsy is not giving you convulsive attacks, so you stop the preventive medication. The sickle cell has not given you crisis, so you stop the preventive medications. Okay, or the hypertension has not given you a stroke. Okay, so you stop taking the hypertensive medications. You don't stop taking medications because you don't feel ill. Okay, the medications are necessary to prevent some complications. All right, so in this video, we have learned about the difference between disease and illness. And you have to know that it doesn't matter the kind of illness or disease you have. Once you are alive, it doesn't matter the level of dysfunction you have. Okay, once you are alive, you can still live a new normal life with disease. So you don't have to feel ill from a disease, especially you don't have to feel psychologically ill from a disease. You can experience a new normal life even if you have a disease. All right? Now let's go to lesson number 4. Now I'm going to talk about the concept of curing versus healing, and you get to know what it means to be cured and not healed, or to be healed and not cured, and how this borders on your achieving well-being.